do not necessarily get achieved by a lot of individuals trying to do their best. You have to build partnerships and teams across geography and across levels of care to make sure that the right care is delivered at the right place at the right time. You need relationships of trust at both ends, and good things happen when you put clinicians, caregivers, together in a trusting environment towards that goal, and that's what I think this is about. So the electronic record provides information. The joint recruitment of clinicians provides a common vision. The administrative and managerial environments are working hard to be aligned and clarified and invest in the same things. Eventually, education and research, it's another part of the OHSU mission, is going to need to embrace and understand the opportunity out there. All of those things are directed at trying to do the right things for reform, the experience, the quality, and the affordability of healthcare. So it's all got great opportunity, and we're looking forward to just getting to work.
Let me say one other thing, then let's just open it up for questions. I like to put a face on, when possible, put a face on goals that we're trying to achieve. And this may be serendipitous or coincidental, or it may be fate, but this morning I walked into my office, and as I was going through my correspondence, I opened a letter from a gentleman in Cascade Locks who has been diagnosed with a very serious disease. It's a long-term chronic condition. His purpose in sending me the letter was to extol the incredible virtues of one of our home health nurses that visits him in his home on a very regular basis, multiple times a week, I'm certain. And I wish I could convey the sense of gratitude and humility and really love that this patient had for this practitioner. This is an OHSU trained nurse. She's a long-term employee here, has worked here for a long time, is a consummate professional, but what he articulated was not only the clinical expertise that she displays each and every time she provides care to him, but her sense of compassion and professionalism and sense of duty. And the diagnosis that this gentleman has, with certainly the training and what we've been able to do in developing our visiting health program, allows him to stay in his home where he otherwise would not be able to be with his family, to be with his loved ones, to be with surroundings where he feels comfortable and at peace. And the diagnosis that he has and the treatment that he is receiving, we receive direct support from OHSU in terms of supporting our clinicians, both primary care providers, specialty physicians, and then our nursing personnel that provide the care. That's where we're headed. That's where we've been. And we want to continue to grow and develop and deepen those opportunities. And with the alignment of incentives of both organizations working in sync so closely, we're really excited about what we're going to be able to continue to create and fine-tune. With that, we can just open it up for questions or...
Well, we're not bashful. Go ahead, Ken.
Oh, I just need to finish skimming a little bit before I ask my question.
Here, we can be quiet and eat crackers and cheese.
I'll start. How long is the agreement? You said long-term. Anything specific timeline?
We have signed a 10-year agreement, but it's the full intent of both organizations that it's not automatically renewable. We want to make sure we're staying close. We want to make sure we're having conversations about how it's going, where we want to go. But I think I can certainly speak for MCMC. I'll let OHSU speak for themselves, but it's our clear intent that this is meant to be a permanent relationship.
Is a copy of that agreement available?
No.
Under what grounds?
It's just a private agreement document between both organizations.
I did check with the public records request, and OHSU is subject to full public records requests.
It is, but there is an exclusion for documents pertaining to health systems that would not normally be supplied to competitors.
Okay.
So legislating was specifically put there legislatively.
Okay.
Yeah, it is a strategic relationship as well as,
Okay.
community members.
Let me ask this, how many employees have you got currently at the hospital? I can't keep up.
We're closing in on about 900.
Okay.
So we're just either shy or just over 900, depending on what day you're talking to.
And do you expect that number to change as a result of this agreement?
Not, potentially as a result of the agreement, I'll go back to Dr. Robertson's comments. We plan on continuing to bring additional expertise, practitioners to the community. We think that will expand. As every healthcare organization in the nation, we're constantly looking at, with the specter of healthcare reform and where healthcare reimbursement is going and how we have to stay very close to our knitting. We're always looking at ways to husband our resources, become more efficient. We do not anticipate any dramatic increases or decreases in staffing as a result of this relationship, but I'll say the same thing that I say internally, Roger, almost every day. We have to continue to be better and be more resourceful and be more efficient at what we do. These are initiatives that were begun 5, 6, 7 years ago, and we continue on that pathway to make sure that we can not only survive but thrive under some very challenging, a very challenging climate of ever reduced reimbursement and a healthcare inflation number that's got to be brought down. So we will continue to work very hard to do that. We think this partnership and relationship helps us in terms of being able to find new ways to look at what we do, but we do not anticipate any significant staffing reductions or significant increases initially as a result.
Quick follow-up and now.
And yeah, I would like to just add
Yeah.
one comment to that. I certainly agree with everything he said, and also, I mean, there's a reluctance to, nobody wants to overpromise, so we don't want to say that they're going to be X number of jobs. However, I am very confident in saying I think there will be medical services available in the region that have not been available before. I do think that would be an outgrowth. Of course, one of the objectives of the relationship is to provide those services more efficiently and more effectively.
Can you give us an example of what you're expecting, new services they'll be able to be provided through this? Or is that still, or will that be developed as time goes on?
Yeah, I think that's a good way of putting it. I think it will be developed as time goes on. We think there are great opportunities in the area of telemedicine, bringing more expertise real time to the region. We've already dramatically expanded what we've been able to do in concert with OHSU for full-time dermatology services here. We're seeing continued demand in that arena. We think there are other specialty and subspecialty areas. Again, we're not ready to be very specific right at this point, but we're pursuing a number of options, and we want to continue to increase access. It's important that you understand one of the big challenges for rural healthcare providers is this ability to attract and retain primary care providers to smaller communities. It's a crisis that's coast to coast. The relationship with OHSU helps us as we establish that relationship with this academic medical center to help us recruit to as Joe mentioned, find that sweet spot of practitioners who see a lot of value in a relationship with an organization like OHSU, but maybe want to practice in a smaller community. We think the stability that gives us, the ability to work with them, as Mark mentioned, in right-sizing the services that are provided here, the ability to flex staff that maybe wouldn't be available if we were all on our own. All of that, I think, is really positive in terms of how we're looking at moving things forward.
Dwayne, does this change the employment situation for your existing physicians? Like in the clinic?
It does. Right now, the agreement that we have with OHSU is we are transitioning now to our primary care practitioners. So it's not only primary care physicians, but it's also mid-level practitioners will be employed we're starting this process right now, and over a period of 2 years we'll transition where they will become OHSU employees.